There's a notes section.
Martina, can you see the screen? Martina?
I can see
Yeah,
the screen.
screen is visible.
Hi, this is Varsha.
Sorry, Martina.
Yeah.
Yes,
I can see
you
the
can
screen.
see the screen. No, you can just see the one screen on the slide, the full slide on the screen, yeah?
Yeah, I can see the slide.
Okay, you can see the slide. You can just check Joanna's display as well. Is the camera working?
No, it's not working.
Okay. Joanna, you can see the slide clearly.
Yes.
Okay, just the slide.
Yeah, just the slide. And
Yeah. I want to
Ashwin
know
is
the
coming.
camera here.
Yeah, Ashwin is coming to fix.
Where, which one? This one?
No, it's not that. Actually, never click on that one because even I don't know what that is.
Ah, yes.
It should be good to go.
Now we can see.
Okay.
Can I check on your screen? It looks good.
Good.
You can hear them, okay?
Yeah.
Okay.
I can hear Joanna and Martina. Yeah, I'll just wait for the moderator to come in. Okay.
Hi.
Hello.
Hi, Rohit. You are able to see me?
Yes.
You're to be clearly.
You're Dr. Varsha Gore.
Yes, right. I'm
Yeah. Hi. Nice to meet you,
from
Varsha.
Apollo Hospitals, Navi Mumbai. Hi.
Navi Mumbai. Okay. Where in Navi Mumbai is your hospital?
We'll invite you. So now the airport from Mumbai is now the city is expanding, as you know. So the road is expanded and new airport is also coming to Navi Mumbai. So it's extension of the city while you go outstation.
Oh, very nice. Very nice. And Navi Mumbai starts from Vashi in that Belapur, that side, no?
Pardon me?
Navi Mumbai is Vashi, Belapur,
Yes, absolutely right. Yes,
yeah,
right.
Sanpada, and all of that.
Yeah.
Hi, Varsha. Hi, Rohit.
Hi, Eileen.
Hi, Eileen.
We're ready. We have another 10 minutes.
We are ready. Oh, yes. Thank you. My coffee is here. So we're ready.
So what is the time in UK?
It's 10 to 10.
Okay.
9:52.
It's 3:22 here.
Yeah.
We'll start at whenever Eileen says and when
Yeah,
you're
3:30 sharp we'll start.
good.
So how has the response been so far of the other 3 lectures that we did?
It has been excellent.
Oh, good.
It's
Glad to
been very
hear.
good. Yeah. We've got many people even inquiring on the other groups. We have had a lot of inquiries.
Nice.
With a lot of interaction, a lot of noise. Yeah.
Good. The topics
and the
are very
topics were
relevant
very
ones.
interesting.
Yes.
Topics were really interesting.
Very new. I was just talking to my colleague and I was telling her that how motivated I feel to speak about this because this is a new gen topic. Because while I was growing up, there was no seasonal affective disorder. There was no SAD disorder. And we didn't speak about mental health, unfortunately, as openly as we can speak now. Youngsters have access to medication as well as counseling more than we had when we were growing up because it was unexplored. And now to the connection, the link between nutrition, dietetics, and seasonal affective disorder is so clear. It's like it's not even ambiguous or there's no cloud over it. We just know how we can resolve the problem nutritionally. So
Yeah.
it's an incredible time, to talk about it, discuss it openly, impart the knowledge we have, and it's all the exchange of knowledge. While preparing this slide, I worked with a young colleague of mine who's just a university graduate and a very bright student who we have taken in as a trainee, and she was helping me make the slides. And the knowledge that the young people have these days on these very relevant topics is incredible. We didn't have this kind of knowledge level on the non quintessential, disorders. So we knew we would read about diabetes, cardiovascular diseases, obesity, and all of that in non communicable diseases. But a seasonal affective disorder, what it was, nobody would know 20 years ago.
True.
Agree.
I was addressing a conference on fish oils, on omega-3 fatty acids in Geneva about 6, 7 years ago, just before COVID.
Okay.
And a professor told us there that until 1993, people didn't know what omega-3 fatty acids were.
On omega-3 fatty acids in
So it's all so new, the nutrition science.
People are joining in. Yeah. We'll wait till the time 3:30. There are people who
Yeah.
are still joining in.
That's fine. We have 4 minutes more.
Yeah. Yes, it's about 3:30. So we can start. We'll start by introducing Varsha Gore. Varsha is the chief dietitian of Apollo Hospitals at Navi Mumbai, and she she has a wealth of experience of over 25 years, and she is also a very strong member of the IAPEN as well as the IDA, and she has completed a number of LLLs, that is the European long learning programs, lifelong learning programs. She's a registered dietitian and a very well known dietitian in dietetics. So, welcome, Varsha, and Academy would like to thank you very much. Similarly, we are very happy that Rohit has joined from UK. It's almost 10 o'clock in the morning there. So, we thank him for being on this program and giving us, sharing with us, interacting, and talking about the most important topic. Varsha, over to you if you would like to say a few words.
Course. Thank you, Eileen, for giving this opportunity. And I'm so very impressed with the Academy of Nutrition Science because I have run through the programs and attended two of the sessions. Those who have missed definitely should take a time and point to make notes because interesting sessions have happened on hypertension, intermittent fasting, meat versus plant-based, and I'm so excited to talk about today's session because this particular topic we must have come across, but we couldn't diagnose as SAD. So seasonal affective disorders will be taken by Rohit Shelatkar, who is the hero for Mayor Vita Biotics. When I was going through his CV, just a quick introduction because it is definitely, a lot of research and product development, more than 100 products globally is not very easy. The passion, the drive, what he has. And we are truly honored to have you, Mr. Rohit. He holds a master's in pharmacy with special interest and special course in pharmacovigilance. And we would like to hear about the topics, special affective disorders, defective disorders, or depression, and how it is, and how do we relate it with nutrition. So without taking more time, we welcome you. It's good morning to you and good afternoon over here. And let's kickstart our
Thank you,
today's
Varsha.
session.
Thank you, Rohit.
Over to you.
Thank you, Varsha. Very kind words for introducing myself. And truly, this is a very interesting topic, seasonal affective disorders and how to improve it with nutrition. And we were just discussing informally before we started the meeting on what seasonal affective disorder is and why is it so spoken about now. Instead of questioning ourselves why we're talking about only now, we should just thank God that we are in a good era. We're talking about seasonal affective disorders. We are talking about more mental health and not just talking and discussing mental health, but we also know how to look after our mental health, which also relates to our physical health. And we are going to explore these things today. We are going to see how mental health gets affected mainly by seasonal affective disorders. Then, how is it related to seasonal health? We'll see what happens at cellular level, the biochemistry behind it, and why is it very relevant to discuss. And also, we'll see how easy it is to treat seasonal affective disorders or anything coming out of a seasonal affective disorder. So here we go. We'll start with the prevalence around the world, and it's very clear here that the belt, which is close to the equator, is less affected, which means warmer, hotter climates are less affected by seasonal affective disorder. It's a subtype of a major depressive disorder, which presents with depressive symptoms during fall and winter that elevate in spring and summer, which means as the daylight goes up, your depressive behavior reduces. As the daylight goes down, the depressive behavior increases. Now, this could be more related to the West or to the Northern Hemisphere, which thankfully India is not a part of. Only about 10% of the northern belt of India comes in the category of the northern part, which is extremely cold, especially Jammu Kashmir and some parts of northern Delhi. Otherwise, the rest of India falls in the tropical belt where the temperatures are quite high, and seasonally it may not be as bad. But in spite of that, you see that winter depression in countries like India, Pakistan, Bangladesh, Sri Lanka, Australia, China, New Zealand, also, in spite of the very cold, very hot weather. And we'll see both the effect of weather as well as other things, such as lack of light. When you talk about lack of light, it could apply to any country, anywhere, and it could just be a result of urbanization. So, for example, in metro cities of India, the temperatures may be good enough to not have seasonal affective disorders. But do we actually make use of that weather, or we keep ourselves, closed in homes and offices and air-conditioned cars and restaurants and shopping malls instead of using that sunlight and going out for a run and do aerobic exercise in the open, etc. So the challenges are not just related to how much sun we receive. The challenge around this is what kind of lifestyle we live and how do we use that sunlight that is available to us. And very interesting to see who are at risk of that. So basically, almost everyone, female, young adults, someone who has a history of depression or psychiatric disorders, anxiety, people who have anxiety, and evening chronotype people, they are at increased risk as this further limits their sunlight exposure. So, family history of SAD, as SNPs in genes involved in serotonin signaling, like the serotonin reuptake transport, can increase its risk as well. So, there are so many different groups here that shows us how widely spread it is and how it can affect mental health. We'll see that. So, individuals with SAD commonly experience symptoms such as depression and anxiety, excessive sleep, oversleeping. I mean, this is not excessive sleep during the night, but also feeling very sleepy in the daytime. Fatigue, which is lack of energy and drive to do something. Irritability, which is being irritable or on the edge all the time, and difficulty concentrating, which can also have be associated with mood swings, etc., and lack of focus. The severity of SAD varies, ranging from mild winter blues to severe depression that affects daily functioning, which means it can be seen more in the winter months where you have less sunlight and more cloudy weather or monsoon, for example. But it can also be a long-term thing which will cause severe depression. So SAD can also influence eating behaviors and that you can see on the right hand side of this slide, um, with a preference for sugary food and a higher incidence of evening snacking, binge eating, and also called emotional eating. These behaviors are highly correlated with hormonal changes, including lower serotonin and higher cortisol levels. Serotonin, as you know, is a feel good hormone, and cortisol is the stress hormone. And this will result in higher appetite. Additionally, intake of sugary foods may temporarily improve your mood as sugar increases the release of serotonin and dopamine for the reward system. Thus, emotional eating provides temporary emotional relief but can lead to overeating, weight gain, and reduced diet quality. Because as you have more sugar, there'll be more uncontrolled insulin spikes. And to control that insulin, your brain is going to be giving you a false message of eating more, and then that vicious cycle just continues. And so the initial effect of having sugar or having carbs eaten at a higher level could be increase in dopamine and increase in serotonin, but long term would be decrease in serotonin and increase in cortisol. So that's the thing I'm trying to explain in this slide, and that would lead you into a vicious cycle of continuous overeating and eventual obesity with weight gain. The circadian rhythm is regulated also by the suprachiasmatic nucleus, which processes light cues to control melatonin production, releasing it during darkness and suppressing it in the daytime. In conditions of short day length, melatonin increase. You can see that melatonin levels increase, causing a circadian misalignment, and the sleep disturbances characteristic of what you see in SAD. This elevated serotonin, these levels will also reduce dopamine signaling by decreasing the expression of tyrosine kinase and dopamine receptors, the receptors on which the dopamine actually acts. Similarly, it reduces serotonin synthesis and increases the serotonin reuptake transporters. So, whenever you go to a doctor and you try to treat these kind of symptoms, the first thing or the first line of therapy a doctor would take is to give a serotonin reuptake inhibitor. And then the next step would be going towards tricyclic antidepressants. The reason why they do that is that if you control the serotonin reuptake inhibitors, you can probably also have a positive influence on serotonin synthesis. And this combined with good or right dopamine signaling, which is directly acting on your dopamine receptors, you will have that feel good kind of mood, and that helps treat long-term long-term depression or anxiety symptoms. So lack of sleep or excess of sleep both can disturb your circadian rhythm, and both could be responsible for over or underproduction of melatonin, and that could be resulting in your dopaminergic neurons not being tapped into enough by dopamine, and that could also result in reduction of serotonin and increase of serotonin reuptake transporters. So it's a very connected cycle, and as you can see that melatonin, good level of melatonin is good to give you a good night's sleep. But if the melatonin synthesis is too much, and if you're continuously producing excess melatonin even in daylight, then that is just going to cause lethargy and depression. So that's the relevance. The circadian rhythm has to be regulated. It has to be regulated between the night and the day act, and the melatonin productions has to be kept consistently high in the lack of light, and hence why we say that a lot of these kind of mental illnesses or sad related symptoms can also be seen in people who work in shift patterns, who work when there is less light, and who sleep or try to sleep when there is light. Because when you put your body into that kind of circle of training the body, training the cells, training the glands into producing melatonin when there is sunlight, you're going actually against the natural circadian, and you're actually destroying your mental sanity. So it's very important to control the melatonin secretion, and the melatonin secretion has to be controlled and produced, limited to produce during the non-light hours. Inflammation is also involved in SAD's pathophysiology, as prolonged melatonin release activates macrophages and the releases of pro-inflammatory cytokines from immune cells. Firstly, cytokines impact dopaminergic and serotonergic signaling by decreasing the conversion of amino acids to these neurotransmitters, while also increasing the expression of serotonin reuptake transporters. They also increase the kynurin production and glutamate signaling, leading to neurotoxicity and altered HPA axis activity. So now again, this is a very related thing. So one thing is managing your sleep and melatonin levels, but also see the inflation in the effect of inflammation on the pathophysiology of SAD. It's so related that the more cytokines are produced by your immune cells, which would be caused because of inflammation in the cells, because of your immune health being down, it will have an impact on not only dopamine but also serotonin, and it will increase glutamate signaling. So again, having your body in the best immune health is very important to avoid SAD. What are the treatment options? Bright light therapy involves sitting in front of light boxes, particularly in the morning, that emit artificial light. It alleviates the depressive symptoms and hypersomnia by decreasing the release of melatonin and increasing the synthesis of serotonin. This is something that is becoming popular, and you can have this remedy at home. People can use this bright light boxes at home, and they don't need to go to a hospital. And this could be done every single morning. And what they do, these light boxes, it just limits or gives right signals to your body to not produce melatonin in the daytime. When the cells, when the body, when through the eyes, of course, is exposed to bright light, the melatonin secretion is automatically reduced. And if you do that, you will have the feel good effect because of increase in the serotonin levels. Exercise is also recommended as it increases the release of serotonin, dopamine, and endorphins while also reducing neuroinflammation, all of which improve depressive symptoms and elevate stress levels. And there is more and more scientific evidence about that now to show how exercise can reduce inflammation not only in the tissue but also at cellular level. In fact, in alternative medicine, we use lifestyle as a 30% factor in improving mental health. So you have the drugs, you have the nutrition, and your lifestyle all divided and all equally important. And one of the important changes that SAD patients should do is incorporate at least 35 to 40 minutes of aerobic exercise every single day, 7 days a week. That what would that do? It would improve your norepinephrine levels. It will reduce cortisol. It will have a reduction effect on TNF alpha, reduce interleukins, increase serotonin, increase BDNF, reduce acetylcholine, increase endorphins, and also increase endocannabinoids, the receptors that sites that cannabis oil, cannabinoid oils work on, which is another different area of health. But all these different neurotransmission areas are extremely important for maintaining good mental health, for removing ourselves out of the antidepressive effect of SAD, improve alertness, and improve the daytime activity levels, improve your focus as well. So we'll go and into this details of management of SAD. We have seen what causes SAD. We have also seen the basic approach of managing SAD, the light lamp, and some exercise. We'll see now in great details what we can do. So, although refined carbohydrates may transiently improve mood due to its effect on the dopamine release, they are digested quickly and cause hyperglycemia with subsequent hyperinsulinemia. This leads to a quick drop in blood sugar levels and insulin, which increases hunger levels again, cravings for carbohydrate rich foods, and fatigue due to low glucose availability. Now, excess sugar can also increase fat production. And this is a very tricky thing. Actually, I read about it more yesterday while I was preparing for this lecture. And we normally think that fat is fat and carb is carb, and the body will use carb to burn to generate energy. And in the presence of high carb in your diet, the body will not use fat to produce energy. But there is a different dimension to it as well, because excess sugar can also increase fat production, as glucose will serve as a substrate to the novolipogenesis in the form of acetyl coenzyme A. This in turn can increase blood cholesterol levels and fat storage in the tissues. To manage the carbohydrate cravings and fatigue in SAD, fiber and protein rich food can be recommended, which can reduce blood sugar fluctuations, resulting in prolonged satiety, lower craving, and fatigue. And you can see this very clearly in this chart here. When you are on a high sugar diet or high carbohydrate diet, which is seen with the red peaks in your blood, you have breakfast, goes up, then it comes down. When it comes down, you have low mood, you have drowsiness, you have high cortisol levels. You eat something again, goes up again, high blood sugar levels in the blood, high fat production, falls down immediately, high cortisol, and drowsiness again. You eat something again, it goes on, and this cycle just keeps continuing. High sugar and high fat production, low sugar, high cortisol, fatigue, drowsiness, and a feeling of hunger again, eat again, and high sugar. So this will just continue. Whereas if you follow the blue line, which is normal blood sugar parameter, shows because of healthy eating, you can see that the line is more stable than the red line. So um, the trick here is replacing the excessive carbohydrates and replacing the cravings of eating sugary carbohydrates by replacing it with fiber and protein. And protein can be both animal or vegetarian protein that we discussed in the last week's talk, but protein is very, very important to stabilize and give satiety alongside fiber. Fiber also reduce the calorific intake of your food, so it's also good. It also feeds your intestinal bacteria. So again, it has multiple good effects. Vitamin B deficiency can lead to depressive symptoms and irritability and may therefore exacerbate SAD symptoms. These vitamins are crucial for the maintenance of the one carbon metabolism, which leads to the conversion of methionine to SAM. And SAM is a methyl donor used in the synthesis of dopamine and serotonin. To benefit their preventative potential, they should be administered together due to their interdependence and in the neurotransmitter synthesis pathway. So you can't just have the B vitamin 1 and B2 and not have B3 and B6. They all work in synergy, and in nature also they come together. They also work naturally occur in food, but not in enough quantities because of devaluation of food. So a supplement could be very useful here, a B vitamin supplement, which will help formation of SAM, which is a methyl donor and helps with the synthesis of the feel-good hormones, serotonin and dopamine. Apart from this mental health contribution, conversion of methionine to SAM is also very important in proper utilization of homocysteine, or conversion of homocysteine into methionine. Otherwise, that homocysteine remains in the blood and it can be harmful to your cardiovascular health. So, B vitamin supplementation is very important. Firstly, because your food doesn't contain B vitamin, and secondly, because B vitamins play all these important roles in modifying your DNA methylation by donating a methyl group, which means it is actually not just affecting your health, but it is also affecting the health of your DNA, which means if you implement all this in your diet over a period of time, it will go to into your offsprings, and then you will have a better and a stronger future generation. This is also called epigenetics, and when I talk on epigenetics, we will discuss more of these things in detail. But that's why B vitamins are so important. In short, the supplementation of B vitamins will not only reduce the symptoms of SAD, but also help with DNA methylation and will also increase neurotransmitters, dopamine and serotonin, and also may have a positive impact on your future generation. Now, the next one is vitamin D. The vitamin D deficiency is seen in patients with SAD, which can be affected by decreased light exposure in higher altitudes and lowered vitamin D stores in winter, leading to greater severity of SAD. Vitamin D enhances the expression of tryptophan hydroxylase involved in the serotonin synthesis. As you can see here, emerging evidence also amplifies this, and it implicates the suppression of serotonin reuptake transmitters. So actually here vitamin D, you can see in this from this slide that it is actually acting like an antidepressant. It is working on the tryptophan hydroxylase. It is getting your 5-HTP, the tryptophan converting to 5-HTP with the action of vitamin D on tryptophan hydroxylase, and then you're getting your serotonin out of that, which is what exactly a lot of anti-anxiety and a lot of anti-depressive drugs do. Next is amino acids. So tryptophan's availability in SAD is diminished due to the action of pro-inflammatory cytokines and increased production of melatonin. The supplementation of L-tryptophan could increase serotonin production and elevate depressive symptoms. Similarly, tyrosine, again, very important precursor of dopamine, its availability may be diminished in if there is pro-inflammatory cytokines. And supplementation can increase dopamine production. And L-theanine again can also improve depressive symptoms as it decreases the glutaminergic signaling. So all tryptophan, theanine, tyrosine, if not adequately found in food sources, it can be given through supplementation. Supplementation becomes very important. And patients with SAD may have also decreased level of coenzyme Q10 due to inflammation, oxidative stress. And as we all know, it's a very strong, potent antioxidant. And that's why coenzyme Q10's endogenous antioxidant activity can decrease the inflammatory cytokine release and restore tryptophan bioavailability and serotonin synthesis. So again, CoQ10 is very, very important in elevating the serotonin levels. Curcumin coming from turmeric, very widely used in the Indian diet as well, but not to an extent it should be. And the bioavailability could be a bit lower in the absence of black piperine. So either you use a lot of turmeric and black pepper in your food or supplement it with a good supplement. And curcumin has antidepressant properties and could be used in the prevention and management of acidity by inhibiting the monoamine oxidase enzymes. It may also increase dopamine and serotonin levels by reducing the expression of pro-inflammatory cytokines via the NFKB pathway. Curcumin can restore your HPA axis dysfunction and substrates for dopamine and serotonin synthesis. So, direct effect on serotonin and dopamine synthesis, elevating, increasing the levels of dopamine and synthesis, serotonin levels in your cells, particularly after affecting your brain mental health. Its antioxidant activities can also reduce mitochondrial damage. It can also protect your mitochondria of the cell, resulting in increased production of energy because you know the mitochondria is the powerhouse of your cell. So if you protect the mitochondria and maintain its function, you will end up making more energy, feeling more energetic, killing the lethargy. Killing lethargy is also one way of looking after the symptoms of SAD. So to manage hypersomnia and sleepiness during the day, exposure to light is very, very important, particularly in the morning light. It could be recommended that it can decrease melatonin secretion in the daytime. So moderate intensity exercise in the morning or early afternoon while the sun is rising, or in the early hours of the sunrise, can decrease sleepiness by increasing the release of serotonin and norepinephrine. So exercise can also indirectly affect daytime sleepiness by prolonging the restorative NREM sleep and improving sleep quality. And if you monitor your sleep, you will see that whilst you're asleep 6 or 7 hours or 8 hours in the bed, you're not actually having deep sleep all throughout. And if you go through the different types of sleep patterns, you see the quality of sleep actually overrides the amount of the length of times you sleep in the bed. And what has there is a lot of scientific evidence. I've quoted two references there, which says that any kind of aerobic exercise, particularly in the out. I mean, I know that in the modern day, people like to go to gyms, etc., which is not exactly working out in the open, but it's not bad. I mean, ideally, you should have a walk or a run and combine with some resistance exercise in the open. But if you can't do that, you can at least walk to the gym, for example, in the morning, have that morning walk done, and do some a little resistance training, a little aerobic workout that will reduce melatonin secretion in the day without affecting the melatonin circadian cycle, and will release endorphins, serotonin, and increase your daytime work quality, your alertness, and nighttime sleep quality as well. So the take home messages are very clear in the 3 point approach that you need to take. One is actively controlling your lifestyle factors, which play a paramount role in the prevention of management of SAD, which is exercising and eating well, and also sleeping well. Second is nutritionally, we are not quite there because our diet does not is not from the scratch, and there's devaluation of food, and food is not giving us enough micronutrients. So we need to be micronutrient. We are micronutrient deficient, and we need to supply enough micronutrients like the B vitamins, the D vitamins. We also saw some antioxidants like coenzyme Q10, curcumin, some amino acids, etc. We need to supplement our bodies with that. And the other is that your lifestyle interventions together, put together with this diet and nutrition, can improving your exposure to natural light, etc., will improve your sleepiness and decrease your depressive symptoms in patients with SAD. We are not trying to alter or reduce sleep. We are trying to manage the circadian rhythm. We are trying to improve the nighttime sleep, and we try to increase the daytime alertness. And that can only be done if all these three are done together: the lifestyle intervention, understanding the factors causing the SAD and then manage those factors. And of course, taking care of the nutritional deficiencies, macros and micros. It's not just that we are deficient in micronutrients, we're also deficient in good quality macronutrients. We need to combine these three factors together to make sure we stay away from SAD by improving your dopamine levels, improving your serotonin levels, and reducing cortisol and glutamate activity in your brain cells. We will have these references, about 60 references on 2 slides, and I recommend that to be read as well. Open to questions now. Thank you for listening.
Thank you, Mr. Rohit. It was really interesting and an eye-opener presentation. I would say you did not only shower sunlight, but a lot of light into the topic because
Thank you.
we do face it, but we are not able to categorize, as you know, it is like a seasonal affective disorder. While the dietitians dwell into the entire diet history, it is worthwhile to understand, deep dive, and as you rightly said, we have to understand the macronutrients and micronutrients too. And thus, definitely, lifestyle plays an important role. I would request all the participants who have logged in to, if there are any questions to post. But meantime, I have a very basic question because when patients meet dietitians in a hospital or in private clinics, because there's a lot of private practicing dietitians, and one of the important question is like, what about the biochemical parameters? Because we don't want to miss out. General recommendations of blood tests are told, but would you like to highlight any biochemical parameters or blood tests which would be of significance? Yes, we do understand about vitamin D3, B12, but you were talking about the hormonals. So, any particular biochemical parameters and the frequency?
No, hormonal changes can be monitored. Hormonal changes can be monitored in terms of levels of serotonin can be monitored. Your activity of dopamine can be monitored. There are several tests, but the easiest test is symptomatic assessment. If you have symptoms that clearly show that you are depressed or you're anxious, they're two different categories. Anxiety cannot be connected to depression. Anxiety is just worrying all the time, and it could affect your day and night sleep. It may affect your circadian rhythm only on one side, which is lack of sleep. Whereas if it's depressive behavior, which is more relevant to SAD, it is your circadian rhythm gets affected in to a 180 degrees, which is only seen mostly symptomatically. There are biochemical tests also to check that, but they will not give you accurate results because you are producing melatonin, but you are producing melatonin at the wrong time. You are producing serotonin as well, but you're producing serotonin at the wrong time because you have serotonin in the night time, and that may keep you up in the night, and you have melatonin in the daytime that will keep you down during the day, so you're not able to function. So SAD is a functional problem which can lead to depressive behavior, and if not taken care of would lead to depression. The way to identify that is B vitamin deficiency. You're more prone to have it, and D vitamin deficiency. But having said that, there would be patients who are deficient in vitamin D and B vitamins and would be perfectly okay because the circadian rhythm is very good. They're sleeping well, they're exercising well. So there could be patients who are marginally deficient in these markers, but they would be doing very well in general. They don't show any signs of depression. So SAD is more of a symptomatic problem than something that will come up in markers. They don't have specific markers, and that's why a lot of time it gets delayed treatment or goes completely unidentified.
So thank you for answering that. We'll take one of the questions little later, but while we were talking, because we would be talking from a dietitian's perspective, and we day in day out do see various reasons which can be attributed to B12 D3 deficiency. We see a lot of issues related to circadian rhythm because of the lifestyle or the work kind of nature different professionals have. So, what about supplementation related to vitamin D3? Because most of them are prescribed with a prophylactic dose, but do you recommend on a daily dose of vitamin D3 and how much it could be like?
So if you're vitamin D deficient or not, it depends upon that. So if you're a vitamin D deficient patient, then a 3 to 4,000 IU of vitamin D for 1 month, followed by a maintenance dose of 2,000 IU for 1 month, followed by a maintenance dose of 1,000 IU for lifelong. Okay, 4, 3, 2, 1. If you are not vitamin D deficient, I'm not vitamin D deficient, but I take vitamin D every day. But I take 1,000 IU because I don't think I need more than that. Their vitamin D deficiency is so common that if we were sitting, even dietitians sitting in one room, and if we check everybody's vitamin D, half of them would be deficient in vitamin D because it's something that doesn't surface unless you see symptoms of vitamin D deficiency. One doesn't think about vitamin D deficiency. And I was for a very long time deficient in vitamin D, although I've worked in the vitamin industry myself for 21 years now and have been making these products, but it's a very common deficiency in case, you're relating that to lifestyle more so. Urbanized lifestyle gives vitamin D deficiency. So I think for deficiency, 4, 3, 2, 1, you can do 4,000 IU, 3,000 IU, 2,000 IU, 1,000 IU. And if you have somebody who's not deficient, then it should be 1,000 IU every day throughout a lifetime.
I think this is a very good number we all can remember, and that's fantastic thing which you have shared on vitamin D and supplementation. And yes, we find 99% deficient in vitamin D. So good knowledge about vitamin D. One of the questions in chat box I can see is related to if you could suggest the curcumin dose recommended on daily basis. I know there's a lot of turmeric coming in your diet, but you being a researcher and a lot of evidence, and so with that, would you like to comment on the curcumin recommended on a day-to-day basis?
So curcumin recommendation in literature is based on the symptoms you're trying to treat. Okay, and curcumin products that are available are based on the extract concentration. What is the concentration of that extract? I would say there is a range. There is nothing like a very bad product, and there is nothing like an ideal dose because it depends upon what you're looking for. Fit for what? If you're an athlete, you need a lot more curcumin, over a gram of concentrated curcumin a day, which is more than 1,000 mg a day if you're an athlete. If you are a geriatric group, you also need a very high concentration of curcumin, and that's because your digestibility or bioavailability through gut is very low in the geriatric age group. Largely speaking, it would between 500 to 1,000 mg of concentrated extract of curcumin is a good dose, but only if it was given with black piperine extract, which is black pepper extract. So if you were to incorporate this outside the supplement, if you were to incorporate this in food also, it's very important to remember that the curcuminoids or the curcumin essentials, the chemicals from curcumin that are useful, will only become bioavailable in the presence of black pepper. So you need to add piperine and curcumin together. If you're taking a tablet, take it together. If you're putting it in food, put it together. And what is also very important is a recent study that has been published, which shows why the Eastern population has more curcuminoids or have a better bioavailability of curcuminoids as compared to the Western population. It's clearly because of the type of fat that is ingested with the curcumin. So if curcumin is ingested with a small amount of animal fat or any medium to long chain fatty acid, it gets better absorbed. And hence why you will see that traditionally people have included a spoon of ghee in something that was cooked with turmeric and black pepper. Maybe they had that knowledge, but maybe it was not scientifically proven, but they had that knowledge of better absorption or whatever through that. And people were doing that. And you can see now in Western clinical trials conducted in America, in the UK, in Germany, you've seen that the two factors that are important for curcumin absorption, more than how much curcumin you give through a tablet or a capsule, is availability of black pepper and taking it with on a full stomach. The reason why we take curcumin on a full stomach is your diet is meant to have some form of fat, animal fat. Either it could be from an oil, a ghee, milk product, a paneer or whatever, but that will help that curcumin to be absorbed.
That's a very good, valid point said that the fat absorption and curcumin will go hand in hand. Next, which can be really related and correlated, is gut-brain axis. So, Dr. Eileen has put a very, very, very intelligent question. How does gut health influence brain health and the mood disorders? Because it is all food, mood, inflammation, and it's a vicious cycle. So, if you can put some information on that, it would be nice.
That is because 70% of the serotonin is gut related, and only 30% is related to the CNS, the central nervous system. So the most important system outside the central nervous system that can control the central nervous system is your GI tract, which is not in itself called a system. When you study pharmacology, we study the CNS for the brain and the spinal cord. You study the ANS for the autonomic nervous system. You study the CVS for your cardiovascular system. But you don't study the gut as a system. But the gut itself, the GIT itself, is a system that controls all these other systems. And if 70% of your feel good hormone, of your the hormone that controls your dopaminergic neuron, your serotonergic neuron, your and your mood swings is produced in the gut by the gut, then of course the gut brain axis becomes very important. In fact, if you don't have a healthy gut, if you don't have a healthy microbiota, your brain health starts getting affected. We should do that as one of our seminars, talk about gut health and probiotics. And it's so important that we've got 14 clinical trials, done in various areas of health, how the gut microbiome affects. And the most important data that we have got collected from all these different clinical trials that we did in the UK is effect on the brain. We have clear evidence to show that a person with a healthy microbiota, which means good bacteria, if not naturally being supplemented through probiotics of 20 to 25 billion CFU per day, would produce more serotonin and more daytime serotonin than anyone else, even somebody in the best health who doesn't have a problem with their mood swings or CNN's health. Even more than them, the person having a healthy microbiota will have a better control on their serotonergic neurons, their dopaminergic neurons, and also will control the glutamate activity in the body. So, increasing serotonergic activity, dopaminergic activity, and decreasing glutamate activity are both just as equal. It's not only the serotonin, the cortisol and the glutamate activity also has to be controlled. And that is done by the gut microbiome. And the gut microbiome can be supported, will only stay alive in a healthy gut. The gut has to be healthy, which means you have to not only supply the adequate amount of CFU of the good bacteria, because the body is losing a lot of millions of bacteria every day through excreta. You need to supply that, and you need to also feed that bacteria. So a probiotic supported by a prebiotic, along with right combination of digestive enzymes, is the right formula to look after your gut. So a prebiotic is just any fiber. Keep a lot of fiber in your diet, and you're supplying prebiotic to your gut bacteria. If you cannot afford a probiotic, expensive probiotic supplements, eat a lot of yogurt and include more yogurt than milk in your diet, and you will have a healthy form of bacteria cultivated in your intestine. But one thing that is important to remember, and which is missed in most of these discussions, is that your digestion and your gut doesn't start in the intestine. Every product, everything, all the therapies available, they talk about the intestinal health. Your digestion starts in the stomach, and what is necessary in the stomach is a healthy combination of digestive enzymes. You need the enzymes that will break your proteins, carbs, fat in the right proportion, the right time. And hence why, if that is not good, your gut is not going to be very actively producing the right amount of serotonin that you are thinking, because of the unhealthy bacteria that will be inadequately fed because of bad digestion in the stomach. And hence I always recommend, if you're a doctor or a nutritionist and you're writing a prescription for a probiotic capsule, please also give an enzyme mix, an enzyme capsule, an enzyme mix. So whilst you are on that therapy of increased probiotic supply, please increase your enzyme supply also. Enzymes will do two things: protect the bacteria until it reaches the intestine, and break down the food adequately enough for the stomach to do most of the work when it comes to food, not the intestine.
Well said. Gut-brain axis is an important topic with prebiotics, probiotics, along with the enzyme. There are a few questions related to specific vitamins, micronutrients. We'll try to take in a given time. So, does adding vitamin K, is it necessary to have vitamin D also, magnesium and selenium? So, we're talking about a bundle of micronutrients. You can open the chat box, it's there. How about
Does
adding
adding
vitamin K? Is it necessary to have vitamin D? Because somebody else also asked, is 1000 IU going to be a higher dose? That was another question. And
no,
magnesium and
1000
selenium.
1000 IU is very moderate dose actually. 1000 IU of vitamin D is something you need to maintain. It's not a very high dose. And if you don't give
Maintenance
1000
dose,
IU,
yes.
which is about 25 micrograms, which is because the conversion factor is 40, you are actually feeding less vitamin D than necessary. It will not do much if you're giving less. And up to 4000 is safe. Going very high is not good. Above 4000, because at the end of the day, vitamin D is a fat. You don't want it to be unabsorbed and stored in your fat cells. So that's why I recommend that for deficiency 4000, 3000, 2000, 1000 in that order. And vitamin K is very important, but not the K1 as much, because the K1 is only important if you have excessive blood thinning problems. And then the K1 can help you thicken the blood, and it's a coagulant. So it would be good, especially if you're going into a surgery that needs a certain level of thickness. Then, doctors often recommend vitamin K1. In my eyes, vitamin K2 is even more important than K1, because the K2 cycle and K1 cycle is different. They way they are digested are different. The way they are processed are in and outside the liver is different. And K2 is important for utilization of calcium and vitamin D3. K1 is not. K1 doesn't play a role in utilization of calcium. With reports coming out of calcification of arteries and that excessive calcium supplements that people take, especially the geriatric group, if it's not absorbed, it settles on your arteries and can cause calcification of arteries, leading to atherosclerosis and heart attacks, etc. K2 has become more and more popular, but I would not combine vitamin K2 in a calcium supplement together. I would say if you want to take extra vitamin K2, take it as a separate supplement. So you take a calcium supplement that should have magnesium and vitamin D, which will absorb the calcium, help absorb the calcium. And K2 should be a separate supplement only for those who do not have any blood disorders, etc. And they can take the K2. Vitamin D should be taken independently, can also be taken alongside a calcium supplement. But 1000 IU of vitamin D is very important. And if you want to go on a vitamin K supplement, it should be vitamin K2.
Well said. So while we are talking about micronutrients and how much quantity is required, there's another question related to that. What is the daily omega-3 dosage? Maybe as per the age or lifestyle, what is your recommendation?
So omega-3 should be actually taken in grams, not in milligrams. If you consider the components of omega-3, which is the DHA and the EPA, the docosahexaenoic acid and the EPA is the eicosapentaenoic acid, they should be considered in milligrams. But when you take the actual fish oil, it should be taken in grams. In the literature shows about 3000 milligrams is necessary. If you go by Lancet data, if you read PubMed, and if you go and read scientific journals, non-advertising journals, not what the companies say, science. If you see scientific journals, they say take up to 3000 mg a day, then you will feel the difference. Now, if you ask me, and if you were to get 3000 mg from a little capsule of omega-3, then you will have to take 5-6 capsules a day, right? Which people don't do.
Right.
It's very clear. I don't think anybody recommends 5-6 capsules a day. So if you ask me, my recommendation is go for a teaspoon or 2 teaspoons of omega-3 oils rather than depending on a capsule. Take have actually fish oils like how we did back in the day, take the oil in a spoon and have it. Then you get 5 grams in a teaspoon, which is nearly a little more than actually the scientific data. Scientific data is around 3 grams. We're taking 5 grams by taking a teaspoonful. I think that is the best way of taking omega-3. Take it with a fish oil. But if fish oil, some people are not agreeable with the taste, they get reflux, burps, this, that, and they don't want fish oil in oil form, then the capsule is okay. But the dose has to be between 1.5 to 3 grams, not milligrams. 1.5 to 3 grams is 1,500 to 3,000 milligrams of omega-3 fatty acids. So make the fatty acids work. Alongside, if you can consume fish twice a week, fatty fish twice a week, it would be very good. And if you ask me examples of fish that are good in fatty acids, then there is uh, sardines, lake trouts, anchovies. You know, the small fish that is small in size is good for omega-3 consumption. The big fish, which is also expensive, is actually not as good because they are very contaminated. The big fish, they live long in the ocean, so they go through the contamination cycle quite often, every year or every 6 months. Hence, the small fish is always good for omega-3 fatty acids and generally good for health.
That's a new learning point about the type, not only the type of fish, the bigger or the smaller. So we are generally talking about, which variety of fish. So that's a good point, I would say. Yeah, there is a question that SAD is diagnosed by psychiatrist, general medical practitioner, according to me, any healthcare professional where a client or patient would meet. So moving further, I can still see a few questions which says, is there any connection between food allergies and intolerances with mood disorders?
Yes,
Yeah.
yes. And I'll give you a specific example actually because it's easier to explain with examples. So if you consider a pregnant woman, right, her immunity is very low during pregnancy. What will happen if the immunity is high during pregnancy? It will reject the fetus, right? Because fetus is foreign to the body. It's not her own. It is the egg and the sperm getting together. So if the immunity is high, the fetus will be uh, thrown out of the body. So to be able to conceive and keep the pregnancy, your immunity has to be low. In that case, you are likely to develop intolerances and what you call sensitivities towards foods and certain things. Those have a direct effect on your hormone levels. Any kind of sensitivity, any kind of thing that is not natural to the body, B vitamins, C vitamin, whatever deficiency that is not natural to the body has an effect on your hormonal balance. So because of that, pregnant women you would see pregnant women um, with low immunity develop these sensitivity towards certain foods, etc., because of low immunity, and they also have a lot of mood swings during
Right.
pregnancy. So this is a classical example
Yes.
of how allergies can develop. If you're not born, it can also develop because of low immunity, and when they develop, they affect your hormone producing glands, and the hormonal up and down would affect mood swings. And pregnancy is a very classical example of this.
One of the questions which I'd like to take, because here there are a lot of incidences of fatty liver, gallstones. So this particular question is the participant wants to know: is there interaction of the side effects, like the overdose of fish oil with people suffering with gallbladder stones? So your
No,
take on
no,
this.
overdose. There is nothing like an overdose because supplements, especially fish oil, is something that you would not overdose. You would not, unless you have some mental issue that you would drink the whole bottle or something. It's very difficult to overdose because these are not acting in microfibers. You can overdose yourself on, say, a drug because it is acting in very low quantity. So instead of one tablet, you may be taking two tablets and you will not know because you forgot that you took one in the morning and you took in the second, so overdose. With fish oil that cannot happen. Firstly, it's very natural. It's like the last week I had 2 portions of fish. This week I'm having 4 portions of fish. Will it affect me? No. you know or next week I may have 6 portions of fish because I ate fish every day. Will it affect me? No. So same with the fish oil. Fish oil is nothing more but the oil extracted from that fish, so it will not have any side effect. The only side effects you
It's
see
just the
with
potent
omega
dose.
3s is a reflux. You can see a reflux, and you may have a acid reflux kind of fish oil reflux. You may burp fish oil, and that could be very unpleasant. But there is a solution to that as well. if you take a supplement that is rich in phospholipids along with fish oils, the phospholipids take the fish oil globules to the bottom of your stomach or intestinal sac. It doesn't float. Normally, oil floats on water, right? Because of the low
Yeah.
density. So when you eat or drink water and you take fish oil, your fish oil is floating on top. Hence why when there is a reflux or you burp the fish oil more than anything else because it's on the top. But if it is bound to phospholipids, which is coming from, which are phosphatidylserine and phosphatidylcholine, which come from something like krill. Krill oil. Krill is red shrimp. So instead of fish, if you replace fish oil with krill oil, you could get over that reflux also. So those people who cannot tolerate fish oil, I would recommend krill oil for them. Krill will has phospholipids. It settles to the bottom of your stomach or intestinal sac.
That's a good point of phospholipids. As we all know, they are good emulsifying agents. So other questions are also related to that. With the interest of time, I'm not taking one questions related to micronutrient supplements because we do understand you need a bundle of B vitamins and antioxidants. So the question was related to specific recommendation on each micronutrient. And there's one question: iron supplementing causing constipation, but I don't know how is it related to the topic on this, because we all know
Iron
that
supplement, but
digestion
we
with
can
the iron is going to be a little tricky.
no, we can quickly address this. See, iron, if taken in excess, will not be activating the ferroportin pump. When the iron is regulated, only about 2 mg of iron is taken in the cell, right, in the liver. Rest of the iron floats, which is not good, floats in the body. To get 2 mg iron, you should consume about 15 to 20 mg of any iron salt like ferrous fumarate, ferric ammonium sulfate, etc. If you take more than 20 mg of any iron salt, you will have those problems that you see with indigestion and constipation, all of that. If you restrict your iron salt to less than 15 to 20 mg, you will not have that. You will get 2 mg into your liver. The rest will be metabolized.
Also, one of the questions is related, which women always complain about mood swings. So, also, if you are having high triglycerides, especially in the menopausal phase, what could be a combination? I wouldn't ask like which is a good supplement, but I would put it in the other words like what could be a good supplement combination you would like to recommend?
So in that phase, the HP axis is very disoriented in menopausal women, and that is a major cause of the mood swings that you see in that. Apart from hormonal imbalances, also you should also understand that they lose about 60-70% of the calcium reserves and about 78%, 7 to 10% of bone mass density within 4-5 years. So it's a whole estrogen levels also fall. So it's a very different menopausal age is a very hormone derived equation, and it needs to be resolved with hormone related situation. I would not recommend HRT, but B vitamins. I mean, if you ask me to pinpoint on one thing, is the B vitamins. If you give enough B vitamins, it works on the HP axis. You have seen how it donates methyl group, how it converts, how it works on hormone levels and increases the level of serotonin in the presentation. In the absence of B vitamins, all these mood swings, etc., are very predominant. In the presence of a high level, good source of all B vitamins, B1, B2, B3, B6, B9, B12, it can be controlled to a great extent. Along with B vitamins, I would recommend soya isoflavones to be used in the menopausal state. That also helps a lot.
Yeah, I think so many interesting questions are coming, but one point taken that there's a lot of involvement of the brain axis, supplementation, and this topic has been really a eye opener. And there would be a chance that we would have missed out certain questions, and we would be taking up and answering them to our participants. So, participants, if there are any questions, please post to us and we will get it conveyed. And then let's hear once again with some other interesting topics.
Rohit,
And
one Rohit, Uma here. One question from my side. It was, first of all, it was very insightful presentation. What I would like to ask you is, today is unlike the earlier times. Today you see that a lot of young people, they are working in shift because of their IT jobs or because of the other countries which they keep on connecting. So what will be one piece of advice that you'll give it to them?
First advice is, look, there is nothing more important than your own health.
Yeah.
So whilst career is important, please make sure you do not do that. Do not make a career compromised on your health, because that's not going to be sustainable. You can do it for 3 years, maybe 5 years, then you will see all the effects, and then neither the career will remain nor the health will remain. So, firstly, don't do it. If you're doing it, the light therapy really works. So, these light boxes that you can use for 10-15 minutes every morning, expose yourself to that, and reduce FSD, use the what you say, the screen light, reduce the blue light coming from screen as much as possible. So if you could take short breaks, even if you're working during night time, put the computer, there are these protective covers that come on computer screens that you can use, and you can take short breaks, frequent breaks every couple of hours. I'll tell you what I do, because I work with all time zones. Uma, you know how many countries do I have calls
Yes.
with? And what I do regularly is I try and make certain number of steps a day. Because I don't have time to go on morning walks and evening walks every day, I try to walk around wherever I can. So every couple of hours, get up from your chair and do 2 minutes of any exercise. It could be
Yeah.
just walking up and down or standing up and down, do some squat or something like that. Do just 2 minutes of something, or just breathe and then come back to your desk. But if you do that every 2 hours, just 2 minutes. If you're working 10 hours a day, you're taking 5 breaks of 2 minutes, you're adding 10 minutes of aerobic exercise without even knowing that. And you reduce the time exposed to the screen. So this can be easily implemented as well for
Yeah.
those who
Thank,
cannot manage the time zones, etc.
thank you so much. It was fantastic, Rohit. Thank you.
I think the questions are not stopping, but there's a lot of excellent feedback coming for the session, and we would like to hear from you on more, or have a longer time workshops or so on. So thank you, Eileen,
Thank
for
you, Varsha. Thank you, Rohit. Today's was excellent. Next time, we are going to meet next Friday again. And we are going to have Zamrud. She is also a very renowned dietitian. She's going to be there, and we're going to talk about thyroid related issues. So I think it's a very in thing. A lot of neat things, a lot of aspects need to be spoken about it. Please do email us if your queries today are not ending, because we have limited time. So we can answer you on email if it is required. And we can end the session now and see you all next Friday again. If you all want, you all can also join the WhatsApp group, because that would give you the updates of when we are having the next program. Thank you so much.
Thank you.
Thanks, Rohit. Thanks, Varsha.
Bye.